My name is Mary Artino, and I am a medical social worker working as a hospice social worker. I have been a social worker for 21 years. I began in oncology social work, setting at a hospital with stem cell transplant patients as well as cancer patients undergoing traditional chemo and radiation. And then I worked my way to hospice, where I've been for the last 15 years. Medical social workers have the ability to work in a variety of clinical settings. In addition to being therapists, we have the ability to connect people to resources such as private caregivers or organizational caregivers. I love my colleagues, I love my patients, their families. It's such a privilege. We're afforded a level of intimacy with people that really doesn't exist anywhere else in society. My family values are central to everything in my life. The way I define myself is I say that I am the physical manifestation of my parents' values, nothing more, nothing less. My parents were 40 when they had me, and so everyone was quite a bit older. And my grandfather was quite aware that he and my grandmother would be leaving relatively soon, so he brought me out into the garden to begin preparing me for their eventual death by looking at the cycle of life and teaching me about that. He grew all of our food and all of our fruits and vegetables and all of our flowers. Our roses were a significant part of our home. I had a patient about 10 years ago, and she was an extraordinary woman. She had a profound effect on my life, and the reason for that was that during that period of time, she told me about everything she was proud of and everything she regretted and felt remorse about. I really think it was because we both had such a deep respect for our family values, and we recognized that in each other. She did not have the ability to complete one last task. And so I asked her if her son could do it for her. She agreed to that. I've learned that all human beings have the ability to heal to some degree right up until the end.